Hello everyone, welcome back to the channel. Nes Ben here, and I'm grateful you have tuned in again. And on today's review, we want to look at myocardial infarction. We have actually started a series where we discuss issues that affect the heart and then the things we need to know even as we prepare for the NCLEX RN exams. In today's video, we would want to briefly cover myocardial infarction, looking at what it is and how we can adequately manage it if we do encounter it in our daily nursing jobs, as well as if we meet it on the NCLEX RN exams. To all our returning subscribers, thank you for sticking with us. And to our new subscribers, we are grateful that you've decided to join the family where we explore everything that has to do with nursing careers, as well as reviews of very important medical conditions that we need to understand as nurses and what our responsibilities are when it comes to these questions. So moving straight into today's video, we want to explore what myocardial infarction is. Now, myocardial infarction is basically when there's an abrupt or a severe deprivement of oxygen for the myocardium being the cardiac muscle. Now, it is important to understand that when there is a disruption in blood flow and oxygen supply to the myocardium, it leads to what we call ischemia. And when the ischemia is not treated immediately, or when blood flow is not restored, the tissues may go into necrosis, which is literally death of the cells of the heart. Now, it is important to understand also that about 500 cells die per minute when the cardiac muscle gets into necrosis. And so it is very important that swift actions be taken when someone is experiencing myocardial infarction. Now, having understood what myocardial infarction is, we want to look at what risk factors puts you at an increased risk for getting or for developing myocardial infarction. The very first one we'll talk about is atherosclerosis. Now, atherosclerosis is basically the building up of plaque in the coronary arteries, which block blood supply or blood flow to the myocardium. And so once someone develops atherosclerosis, they are at an increased risk of developing myocardial infarction. Also, coronary artery disease. Now, we know that the coronary arteries supply the myocardium with oxygen-rich blood. And so, when these arteries are diseased, it may lead to myocardial infarction. Now, there are some lifestyle choices that may predispose you to developing myocardial infarction. And the very first one to talk about is smoking and alcohol use. Now, this habit increases your risk for developing MI, and so we advise that this be reduced if cannot be stopped. Also, when you have high cholesterol levels, because cholesterol is fat and plaques develop as a result of fatty deposit. When you have high cholesterol levels, you are at an increased risk of developing myocardial infarction. Now, I want to also look at obesity and physical inactivity. Now, once you do not exercise or once you are obese, your vascular walls become very weakened, and when it bursts or when you get a rupture and there's a clot formation, then fatty acids then build up on this clot formation and can lead to myocardial infarction. The last two we'll talk about will be diabetes and hypertension. These two disease conditions increases your risk of developing myocardial infarction. Moving forward, we want to look at how we diagnose myocardial infarction. Now, it is important to understand that certain diagnostic texts will give you context as to why the patient is experiencing the chest pain they are experiencing. In our previous videos where we talked about angina, we said that the angina pain has got certain characteristics which, when it's present, we can confidently say the patient is experiencing angina pain. Now, same applies to myocardial infarction. There is a certain kind of pain one would experience, which we will look at when we are looking at our signs and symptoms. But looking at the diagnosis, we know that when there's cell death, the byproduct of cell death or myocardial cell death is what we call troponin. So troponin is released once the cell dies. And so you want to look at your troponin levels. Usually you find a rise in your troponin up to 3 hours after a chest pain has started. And then this can keep elevated or can be still elevated up to 10 days post chest pain. The other thing you want to look at will be your total CK level. So CK is your creatinine kinase. This is also released as a result of cell death, and this usually see after 6 hours rising, which usually would peak at 18 hours following your chest pain. Now, we would also need to do an electrocardiogram, which is an ECG, and basically changes in your ST segment will tell us what level of myocardial infarction you may be experiencing. So when you have ST elevation, it's indicative that there is no oxygen supply to the myocardium. However, when you have ST depressions, it indicates that there is very little or low amount of oxygen getting to the myocardium. And so an EKG is one of the quickest ways or one of the quickest things you can do to determine whether someone is actually experiencing an MI. In some cases, you can also do what we call cardiac catheterization. So what happens in cardiac catheterization is that you're taken to the lab and then we get to visibly see the vessels and see where the problem is. And usually we can correct once we see where the problem is coming from. Now we want to look at the signs and symptoms of myocardial infarction. Now it is important to know that chest pain is one of the cardinal signs of myocardial infarction. But this chest pain is often described in a certain way. And so that's what we want to look at. So mostly the chest pain usually would occur without a cause and is mostly described as crushing substernal pain. So just behind the sternum is where you experience this pain. Now the pain may radiate. So it may radiate to your jaw, down your arms, to your lower back, and sometimes it may even be just described as an epigastric pain. Now, usually this pain will last for 30 minutes or longer, and it's not relieved by rest or nitroglycerin. When you listen to the previous videos we did, we said in some of the angina pains, once you rest or once you give nitroglycerin, your pain should be resolved. But with myocardial infarction, your pain is actually resolved with the administration of opioids. So morphine is a very good opioid to give in myocardial infarction. Why morphine and why is it given as a priority? What morphine does is that it increases myocardial oxygen supply. And so there's more oxygen that is able to get to the myocardium. But we need to remember mnemonic, which is MONA. So MONA is basically how we treat myocardial infarctions in the acute stage. So your M is morphine, which is an opioid, which is the best treatment for myocardial infarction. Then we have oxygen. So once you give morphine, you give oxygen to supplement the supply that the heart is getting. You can then give some nitroglycerin. What it does is that it dilates your blood vessels and allow for more rich oxygen blood to get to the myocardium. And then finally, you give aspirin as part of the treatment for myocardial infarction. Now, some of the other common signs and symptoms you will find aside the substernal chest pain is nausea and vomiting. Also, you can have sweating or diaphoresis. Now, most often your chest pain is accompanied by shortness of breath, and this is something we need to take note of. Some people may have a feeling of fear or anxiety. Now, these are some of the typical signs and symptoms that will accompany your crushing substernal pain. But we also need to say that in certain individuals, they experience atypical discomfort, especially for women. Now, most women may not experience your substernal chest pain that is very peculiar to myocardial infarction. Rather, they would just say we feel a bit of discomfort, and that could be them experiencing a myocardial infarction. Also, persons who have diabetes, when the diabetes is advanced and their nerves are affected, they may not experience the typical pain everybody would describe as associated with myocardial infarction. I hope this video helps you to quickly embrace the concept of myocardial infarction. If you found value from this video, I will encourage you to like the video, leave a comment. You want to subscribe to the channel as well, so when we put up new videos, you'll be one of the very first people to see it. Thank you for sticking along with us even to the end of the video. Thank you very much, and we'll see you in the next one.